So, Brad, tell us a little bit about this. Well, first of all, what is access like for primary care in Utah? Where do we rank in the United States for access to primary care?
I found this statistic really interesting. So one of my friends sent me it last week from the U.S. Health Department, and essentially we are dead last. We are the worst state in the nation for access to primary care providers. It is harder to get to a primary care provider in Utah than any other state in the nation.
That's crazy.
Yeah.
What are some reasons for that?
A lot of the ones that we talked about this morning is being a primary care provider is really hard. It's very taxing. The turnover rate is really high. There's a lot of providers that just don't want to go into that anymore. It's kind of losing a passion because there's so much that has to be done. I'm not a primary care physician, so I can't speak to all those things, but those are the few of the things that we talked about this morning.
And
is there any others that stuck out to you?
Yeah, I think the primary care physicians it's a tough job. There's a lot of coordination of care, which is time consuming. When you send a patient out to a specialist or multiple specialists, and you're constantly in coordination with them, the primary care physicians will be texting me about patients pretty consistently, and that's a very time consuming thing that's probably not reimbursed. It's just part of what they do to serve patients. The cost of living in Utah has risen substantially. The reimbursement in Utah is still one of the lowest in the United States, and so the combination of those things has really driven a lot of primary care physicians out of the state.
Yeah.
And physicians in general, and so there's some work to be done there. But yeah, there's a lot of reasons for it, and it's sad to see that a state that I think values health as much as maybe anybody, at least the perception of valuing health, and the fact that our access to primary care is so diminished.
Yeah, and I've definitely realized in my role as an entry point to the healthcare system, I ask people every intake, who's your primary care physician? And the majority of people say, I don't have one.
Yeah.
And I ask why, and they said it's just too hard to get into them.
Yeah.
So they rely on the emergency room or Instacare as their primary care role. But when you have a primary care physician, they know you. They know your history. They know how you've evolved since you were a teenager, and there's so much value to what they do.
Yeah. So tell us a little bit about this new legislation in the state of Utah that you were a part of, and is, I think, at least part of the solution to this access issue that we have in the state.
Yeah, I love that you say a part of it, because really it's that, right? Like it's a small solution, and we have a lot of physical therapists in Utah, but the primary care bill was passed unanimously in the House and Senate and signed by the governor, which allows for patients, which we've already had access to care. We've had this direct access role where people could come to us without a referral, most insurances. But this primary care bill allows for improved access because you have more providers across the state of Utah, and then decreased cost, because is what we're going to do is we remove this specialty designation. So a PT is no longer recognized as a specialist, which will reduce copays. We're going to work with insurance companies over this next year to demonstrate how it's going to help them. So we want to reduce those copays to a fair copay. So instead of maybe a $75 copay to get to a physical therapy visit, maybe it's $10. It's more acceptable within a primary care role. So really there's two portions that we're really pushing hard: improving access and decreasing cost for patients. That was the pure intent of this bill.
And what effect will that have, do you think, in our state, if patients have better access to primary care and specifically can get into their physical therapist sooner, faster, more easily to basically get the process started for evaluation and eventual treatment?
Yeah, I love that question, because what you see this in your practice. The longer people are in pain, the harder it is to get them out of it. Mm-hmm. They stay in this cycle, and then it essentially changes brain patterns. And they stay in those cycles, and then the pain gets worse. And then they stop doing their activity, and they essentially can become addicted to pain medications, or they just get stuck in this system but it's more on the preventative side. We are focusing on getting people in fast and getting them back to activity as efficiently as possible. If we can get people in a PT clinic after an injury within 30 days, it drastically changes the outcome of that patient. So we want to expedite that process and get them in within those periods because we want to get them back to what they love. But if they're in there for longer than 30 days, then pain becomes chronic, and chronic pain is an epidemic now. What do you see in your practice?
Well, I agree. I think the earlier that patients understand the issues they're facing and get evaluation and treatment, the better. And it's way more cost effective that way. You said in the rounds, and I agree with you, that the best kept secret in medicine is the value of physical therapists. And it's a resource that patients maybe don't realize is there's a lot of physical therapists in our community. There's a lot of excellent physical therapists in our community. And I love this move by the state. I think it's a great way to address the shortage of primary care.
Yeah, I think it's really going to improve collaboration. I think something I hope our profession does really well is works together more as a team.
Yeah.
Because in a primary care role, you have to know your resources. You have to know who to refer to. You have to have trust in them. And then you have to build that bridge.
Yeah. One other thing I was thinking, which was not really discussed this morning, but in my mind, there's 3 pillars of health. One would be the quality of our social relationships. Another would be movement and activity. And the final one would be nutrition. And I don't think there is a specialty within medicine that aligns better with those 3 things than physical therapy.
Yeah.
So it's a perfect primary care role. Prevention, movement, activity, and nutrition, and the encouragement to be connected.
Yeah.
And so I think this will be a great thing for patients in the state.
Absolutely. Love that.
Okay. Well, thanks so much for presenting this morning. That was super fun.